guys have any discomfort in this area or here or even here? Well, today we are going over muscle imbalances and how they can be creating some of your hip impingement type symptoms. My name is Dawn, this is Sebastian. We work at Performance Place Sports Care, and we are the locally world famous chiropractors.
Locally world famous.
Oh, you gave it some effort this time, I like it.
I felt like I didn't give a lot.
Well, I'm going to explain a little bit, and then we're going to show an exercise that you can do, okay? So a lot of times, actually, when we're talking about muscle imbalances, we're looking at the way that you load into certain hips with certain movements, and I think that squatting is kind of one of those typical ones that we can start with a testing with. Why are you looking at me like that?
I have a good idea.
What?
You keep talking to them, and I'm
Okay.
going to go grab the hip model.
Okay.
Muscular imbalances, right?
Let's do it, yep.
Okay.
Do it. So what we do, we test people's movements in here when they're coming in with hip impingement type symptoms. And a lot of times what we'll see is they like to load and shift in different directions, sometimes away from the pain and sometimes into the pain. And now Sebastian's back with the model, so let's see what he has to say about it.
I want you to continue. No, she's right. So a lot of times people will load into the side of complaint, you said, right?
Uh-huh.
Which is important. Why is that important?
You tell him.
Because it's your video. Okay, fine. So a lot of times people will actually, they have hip impingement on this side, and this side there's the muscular imbalances, and they're like, their body's like, you know what? I'm just gonna get away from those muscular imbalances. Is that what you're gonna say? So.
I think the model was just unnecessary.
Oh, I think the model would be great because you guys want to see the muscles, right?
Show him.
Okay, fine. I'm going to hear about it later. She's going to be like, that wasn't needed. Okay, so here's the hip, and here's your hip joint, and here's all the muscles around it. Then you have the piriformis and the obturator and the glute medius. The glute max is in there, which is the more important one. And there's the hip flexor. So a lot of these will have imbalances associated with it. But when the side has imbalances, sometimes people shift weight to the other side, which creates the hip impingement, right?
Absolutely. So now that we know the anatomy, let's get into it.
Jeez.
All right, Sebastian, show them an imbalanced squat for me. Show them what we're talking about
I
here.
thought I just did that. Okay. So, Doc, I have hip impingement on this side. It shows it on an image.
Okay, in exam, show me your squat. And he's, definitely exaggerating it here, but you see different variations of this a lot. People really load into the problem side. And they want that side treated, but really what we're gonna do is actually get the opposite side to work a little bit better. So I'm gonna have you go non-problem side down and set up in what we call an accordion exercise, okay? So he's here, starting here. What I want you to do is roll into that front knee there until you can feel floor contact. Press the knee through the floor and come on up. Perfect, come up even higher. Good, open up, scare the mountain lion. That's Sebastian's cue. Perfect, and then back down. Awesome, go through the movement here and I'll kind of take them through it.
I was just thinking about all that model and
So the reason this is called an accordion exercise is because, look, imagine he's got one between his hands here and one between his legs here, and he's going to be playing the accordion at both angles here. What do you feel working, Seb?
I feel my right butt cheek.
Perfect. Awesome.
I don't feel this side really.
That side's not really doing much work. And so what
But I'm here for that left side. Why are we doing the right side?
Well, that's kind of what we described in the beginning. So ultimately, that left side is overworking, and we need to get something else to come in and help this hip out. And a lot of times it's opposite side, or maybe sometimes it could even be some core activation stuff. Sometimes it can even be opposite side foot. I'm going to keep talking until Seth is dead here.
I can see that bringing that model in was a mistake. Okay, I'm pretty
Ultimately, though, you guys, when we're doing exercises like this, it's not just do a couple and see what happens. You really, really want to try to find a challenging amount. So when you feel like that right butt cheek is really smoking and it's almost absolutely well done, do a couple more. And get up and see, maybe test your squat or test something that usually creates some provoking symptoms into the problem side and see if it made it any better.
So it's interesting, sometimes when you really challenge that right side with the muscular imbalances, then you actually see people, they stop squatting into the side nearly immediately within like a minute or so of the exercise. Without having to actually think about it, they actually shift more center, or it's funny when they almost fall over the other way.
Yeah, that is true. I've seen that sometimes where now they're squatting into the side you just loaded. So,
Yeah.
yep.
So in a following video, we'll give some reasons why that is actually helpful. We're fully aware that we're treating the opposite side, but there's a reason why that other side is getting hip impingement symptoms. If you have more questions about hip impingement, sports hernias, hip flexors, piriformis, and so on, we have a webinar that we created. It's 20 minutes long. I know it's long, but don't worry, Seinfeld's just as long. And you'll get way more information from it. So please check it out. Subscribe to the channel, and you'll see the other video. We're going to talk about how an examination can correlate to the uneven squat.